Today I'll teach you the proper way to examine the respiratory system. Together with us is Dr. Shahrudin and our patient from Ward 7S. To start with, you should introduce yourself and tell the patient what you are going to do. After that, just take a few steps backward and observe the patient as a whole. Look for evidence of respiratory distress, dyspnea, tachypnea, use of accessory muscles of respiration, and if there's also evidence of wheezing or stridor. Come close to the patient and start count the respiratory rate. It should be done preferably in 1 minute or at least 30 seconds. After you have finished, now examine the hand. Look at the hand carefully, and you have to look at both hands. Look for evidence of clubbing, and this patient has finger clubbing. And Dr. Shahrudin is showing us the clubbing of the fingers. For examination of the hand, you should also look for evidence of nicotine stain and also evidence of any anemia, that is any pallor. And now you should also look for, you should count the pulse rate. Look for evidence of any bounding pulse. Next, look for evidence of flapping tremor. After that, go to the neck, observe and look for evidence of superior vena cava obstruction, in which you can see the fullness or any engorged neck veins. Look carefully for the raised jugular venous pressure, because it can be increased in cor pulmonale. After that, examine the eyes for evidence of pallor again, and look for evidence of jaundice. Examine the oral cavity for central cyanosis. Now you have a look at the both ankle to look for any evidence of ankle edema. Right, now we have finished the general examination of the respiratory system. Come closer to the chest again and observe. Observe, is there any chest deformity? If there any abnormal bulging or old scar, look carefully by the side, because you may miss the sign. Any dilated veins, and so on. Alright, after you have finished, ask the patient to take a deep breath. Okay, look for evidence of any asymmetry. Okay, now palpate the trachea. The trachea is normally central, or it may be slightly shifted to the right. Be gentle because it is quite painful if you don't do it properly. After that, palpate for the apex bed, because there are some chest pathology which will lead to mediastinal shift. After we have finished, do the chest expansion. It should be done from the uppermost of the chest, the upper zone, followed by the mid zone, and later the lower zones. After that, do the tactile parameters. You can either use the whole palm or you can use just edge of your fingers. Finish with that, you can palpate. Start palpating the clavicle. Tell the patient that what you are going to do now. Continue to do the percussion. For a right-handed examiner, the middle finger of the left hand is placed firmly on the chest wall of the patient. The middle phalanx of the left middle finger is struck by the middle finger of the right hand. The palm and the other fingers are lifted clear of the chest to prevent any vibration. Both sides of the chest should be percussed. Look for evidence of increased resonance or decreased resonance or any evidence of dullness. After you have finished, then do the auscultation. It is preferred to ask the patient to cough up any sputum first before you listen. Use the diaphragm of the stethoscope and ask the patient to breathe deeply through the mouth. Listen at the top, middle, and bottom of both sides of the chest and assess the character of the breath sounds. Don't forget the axillary area. And finally, assess the vocal resonance. To complete your examination, you need to examine the patient's back. Now, ask the patient to sit and move so that you are facing the patient's back. We continue our examination of the respiratory system. You need to examine the patient from the back. Observe carefully from the back for any evidence or any abnormalities, for example, scoliosis, any surgical scar, or any abnormal bulging. Take one or two steps and ask the patient to take deep breath. Look for any asymmetry. Now ask the patient to move both his upper limbs so that you will have a better examination area, because now the scapula is going to move outside from the midline. Again, do your chest expansion from the upper, middle, followed by lower zones. Look carefully for movement of your thumbs. After you have finished, do tactile vocal parameters. Finish with palpation. Now you have to do your percussion. Start from the upper zones, followed by middle zones, and then the lower zones. Try not to percuss on the scapula. After you have finished, listen to the breath sounds again. Do it from the upper zones, middle zone, and followed by lower zones. Compare both sides. Lastly, do the vocal resonance.
Satu-satu ya. Satu-satu. Satu-satu. Okey. Satu-satu. 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 Lagi. Satu. Okey. Satu-satu. 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 Lagi. Satu-satu. 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 Lagi. Satu-satu.
Finally, to complete the examination of the respiratory system, you need to examine